So Achilles tendon discomfort is a very common problem that we see. The Achilles tendon is actually made up of two tendons that merge into one. There's two separate muscles in the back of the leg that merge their tendons to make the Achilles. And typically what we find is one of those tendons is a little bit short and it creates a tension problem. And so as the muscle that's a little bit short is trying to pull the heel up, the body weight's pushing the heel down, you get a chronic stretch and an overload to the Achilles tendon that can wear down over time and become symptomatic. Patients typically present with pain over the back of the ankle. You can have swelling. You can have Achilles tendonitis in two different locations. Commonly, it's over the back of the heel, and patients can get a big bump over the back of the heel that's painful with shoe wear, or it can be a little bit higher up over the tendon itself. Regardless, the treatment options are pretty much the same starting out. Depending on the severity of their pain, we can start with calf stretching first to try and lengthen that calf tendon that's contributing to the tension problem. We could try immobilizing you in a boot. We could augment with a night splint to try to stretch you out at night while you're sleeping. And then if patients fail that, we typically look at obtaining an MRI just to see what kind of changes are in the tendon to help guide surgical treatment if we need to go that direction. A lot of times, whether it's at the back of the heel at the insertion, or if it's above at the tendon area, the non-insertional part of the Achilles, we can still talk about doing a small procedure where we stretch that tight calf muscle that's contributing to the tension problem with a very small surgery, very short recovery, very low risk, and allow patients to get up and ambulate immediately afterwards and spend about 2 weeks in a boot and then send them to physical therapy once the wound is healed. Achilles tendon ruptures, I think, are a continuum of Achilles tendonitis. The Achilles tendon with the tension imbalance becomes abnormal. You get changes to the tendon from that chronic tension, and it does weaken the tendon. And so patients a lot of times will describe Achilles pain before they sustained a rupture. So when patients present and we have concerns about an Achilles tendon rupture, this is probably the only time in my practice where they present exactly as we were taught in medical school. They're typically somebody my age, weekend warrior. They're out doing something that maybe we shouldn't be doing, trying to play basketball, remain athletic. But it could be something as simple as stepping off of a curb. And patients will typically describe the sensation of being kicked or somebody hitting them in the back of the leg. And then when they turn around, there's nobody there. And so that's a fairly classic presentation when somebody ruptures their Achilles tendon. And so an Achilles tendon rupture is something that historically was always treated surgically. More recently, there's a lot of data that talks about conservative management of these. And so conservative management does not mean that we just, tell you you'll be fine. There is an algorithm that we have to follow, and patients can do quite well. It involves being immobilized in a boot for a period of time with some lifts to get your heel up, to try to shorten the Achilles and allow it to try to grow back together. The standard way of treating these surgically is you make the incision, you sew the tendon ends back together, and then you're immobilized with the toes pointing down to keep the tension off the tendon. Both ways, I pretty much am starting therapy, whether I operate or not. We're starting therapy around 2 weeks after surgery, or when we first see the patient with the injury and start the non-operative algorithm. And roughly tendon healing takes about 3 months. So once we get to about that 3-month mark, if the patients are doing well, we'll start to restrict them less and start progressing their activities more.